feeling pretty excited right now because I haven't been able to chew on this side of my mouth in over a year now. Like, that means no steaks for Justin, or at least it's not enjoyable because I'm all on this side and I'm wearing my jaw out. So today, it's like the third visit. We're gonna get my partial fitted. Partial is like a, what's it like? Fake tooth? But it's for 3 in the back, 3 teeth. So that's gonna be interesting. I was just with the massage therapist and she felt some tension in my belly, like fear. Is it because it's the dentist or because I'm having to film at the dentist? I don't know. I don't have any reason to fear. I don't think he's gonna use that on me today. I think it's gonna be a pretty easy visit. No drilling. I'm looking for evidence of drilling. Oh gosh. I don't think that's for me today. I think it's just x-ray and fitting it and seeing if the color's right.
Okay, you're the man of the hour.
I'm in.
How's it going?
Good, how are you?
Good.
Good.
Am I on camera now?
You are on.
Hey,
You're rolling.
good to see you.
All right, what's your name?
Dr. Matthew Young. I'm here in Hendersonville, North Carolina.
Okay.
Well, let me show you where we are with your treatment here so far. This is a machine called an articulator, and this shows how your teeth fit together.
Okay.
And we lock it back together again, and then this is...
It's a full model of my teeth.
Yeah, isn't that cool? This is the most durable type of partial that you can make. It's the most stable. It has the thinnest profile to it. It's an easier partial to reline and repair in case something were to happen in the future. So this mimics your teeth. Hello, hello.
Beautiful teeth.
Yeah.
Now that's also the least invasive way to deal with a lost tooth.
Exactly.
Too. You could do implants. You could do. Is it implants?
Right. You could do an implant in the bone down here, but if you look really closely at the bone, it's very thin.
Yeah.
And it's very tall. So you'd have to do bone grafts to widen it. Which would be very invasive. And then if you try and put a large implant in the really skinny bone, it's like you're putting a large nail into a thin piece of wood. It could crack.
Okay.
So this is the least invasive way of doing it, and it worked really good. Cool. So now we're going to try it in for size.
Cool. Okay. Now, Dr. Young, you're always so cheerful. You always greet me so cheerfully, and I always see you greet others so cheerfully.
Good. That's because I enjoy what I do.
I was going to ask that. Is it that, or is it just good business?
A little bit of both.
You really enjoy.
Yeah. We enjoy what we do, and since we switched over to the holistic approach about 15, 20 years ago, it's been a blessing because you're helping people so much more than just traditional dentistry. Yeah.
And you've been doing dentistry for how many years?
35 years.
You're still happy to see people.
Oh yeah.
Inside of their mouths.
Exactly. So now we're going to try them in, see how they fit. It should fit right in your mouth the same way as it does on the model. And sure enough it does, so you can feel how stable that is. It's not going anywhere. And then I go from front to back on either side, and it feels good. So now we check the color. And we check the fit.
So that's how it gets supported. It's actually got a piece that goes around.
Oh, that's a cool 3D shot right there. Now it's still in wax right now, so we're just doing a test.
Okay.
This is our articulating paper, so we're going to chop, chop, chop on this side. Cool. We're going to go over here on this side. Chop, chop, chop on this side. Hold your teeth together. Good, and open big. Flip around, grind, grind, grind. Grind, grind, grind like you're biting like you're a cow chewing on your cud. Good. We had several patients who had come in with chronic illnesses, fibromyalgia, chronic fatigue, migraine headaches, all different kinds of chronic issues, and they wanted someone to safely remove the mercury from their mouths and from their teeth. And I began to do some research and discovered how toxic the material was, so then I began to learn how to do the safe amalgam removal techniques that we do.
Just give me a tour of anything you want.
Okay. So yeah, this is what's called our mercury monitoring system. If I open the door, you can see inside. This machine takes the air samples from 8 different rooms in the office, And what it does is it runs it through this machine on top, which has an optical cell with a laser shining through it. If there's mercury in the air, the laser absorbs that light, and then there's a detector on the other side that tells us how much mercury is actually in the air. The ambient level of mercury in the air right now, as you can see, is between 0 and 0.1 micrograms. So we know we're keeping a clean environment for our patients and our staff. If you take just a little bit of mercury off the head of the dental drill after you have a mercury filling removed, we put that on a sponge here, and then we take the sponge and we sample it with the airline, and we've gotten numbers as high as 1600, 2500, which is 25 times more than what OSHA says you can breathe in a single day.
Okay.
And that's just off the head of the drill after the mercury filling's removed. So we have our special scrubbers that we use to clean the air, and our filters. This is one of the filters we keep in here to make sure this room stays mercury free. And then we have the large air filters that we use in our rooms, okay?
And what's the problem with fluoride?
Fluoride, the best place to find information on fluoride is on the Fluoride Action Network, which is an excellent website run by Dr. Paul Connett. He talks about 60 to 70 different toxic effects that fluoride has on the human body. For one, it robs the thyroid gland of iodine, making it difficult for the thyroid gland to produce thyroid hormone. It can incorporate in bones. It increases the risk of bone cancer in certain young men. It interrupts the way the brain cells talk to each other, so it can actually lower the child's IQ. And that's been recorded, and it's been a part of the scientific journals here for about the last 5 years.
What do you use instead of fluoride?
We do a lot of iodine therapy. So iodine will target the same bacteria that causes cavities. And if you'll paint the iodine over the teeth, it kills those bacteria, and it helps to reduce the incidence of decay.
This is why my kids like to come here, Dr. Matthew Young. That's the secret right there. They're gonna like that. That wasn't here last year.
This is brand
happened to the old one.
This is our new Mega machine because the old one had some mechanical issues.
It's amazing all you have to do to make a kid comfortable with going to the dentist.
That's all right.
If only you had something like that for adults. Like new cars and stuff.
Exactly.
A new iPhone.
Now, working back into our rooms, we realize that when we take the mercury fillings out and you touch it with the dental drill, that a large cloud of mercury vapor and particulate can fill up the room. So this machine is called an IQ Air. It has 2 large HEPA filters in the bottom, and then it has 4 large carbon filters here in the top. So I'm going to turn it up to give you an idea about how loud it is. So this is going to clean almost 300 cubic feet of air a minute, and it pulls in the contaminated air here.
Yeah.
Put it very close to the patient's face, and then the clean air comes out on the top.
Yeah.
So this is the main thing that keeps the environment clean for our patients and our staff.
Yeah.
We've also learned that the particles can hit the floor, so now we take a dry Swiffer pad and we spray it with a sulfur compound, and we actually Swiffer the floor with a special compound to help neutralize the mercury on the floor.
How far do people travel to come see you?
We've got people that come from Virginia, Ohio, Tennessee. I've got a doctor and his family who drives up from Florida, Myrtle Beach. So we have people from all over the Southeast that come see us. We also give the patients oxygen to breathe. You can see the oxygen line over here.
Ah, yes.
And then we cover the tooth with a rubber dam, and then drape the patient with a special mercury resistant drape. So the tooth will go through that rubber dam like that, and the patient's totally covered so that no mercury particles can get in their skin or their hair.
I vaguely remember that. I first came to you because I had mercury fillings and it was affecting me negatively with Lyme disease.
Right.
We had to get them out, but you have to get them out safe, and there's only so many people that do it.
Yep.
Yeah.
Right now we have a new system up called SMART system, which stands for Safe Mercury Amalgam Removal.
Okay.
And so if you're SMART certified, or if you go to the SMART website, then you can find a dentist in your town or your state who can do it for you.
Okay.
We're also really big on ozone. This is our medical grade ozone machine. You turn the oxygen on this side.
Yeah. Now you did this to me after you pulled a tooth once, I think, to clean it. You use this. That stops infection.
It helps kill bacteria in the blood clot. And then we also inject the ozone directly next to the bone and allow it to slowly work its way. As long as this blue light's on, we're making ozone. And so the pure oxygen comes in here, the ozone comes out of here, which is basically instead of O2, you've got O3.
Yeah, what is ozone?
Ozone is a natural antibiotic. It kills bacteria 3,500 times better than Clorox.
Okay.
And so if you put ozone over the tooth, let's say this is your tooth.
Is that liquid or air?
It's gas.
Oh.
And you spray the ozone down onto the tooth, then you're killing the bacteria before you apply your filler.
And it's natural?
It's totally natural. Ozone comes from the word in German that means sweet smell, so that's the smell that you notice when a thunderstorm is about ready to.
That's ozone.
That's
actual ozone.
The ozone comes into this bottle, and we use this 5-gallon jug of distilled water, and we fill it up, and now this water is being ozonated. So as we're using the water in our demo units here, in these bottles,
yep.
When you get your teeth cleaned or if you have a filling done, then we're using the ozonated water to kill the bacteria at the same time.
Cool. You once did this after you pulled a tooth, and I felt like I was 25 again.
Good.
I just had energy.
Wonderful. We love to hear that.
And the people who are seeing this all over the world and are interested in more of this, or even interested in coming and seeing you and with their families, what should they do?
They should go to our website, which is www.matthewyoungdds.net. If you don't want to travel to North Carolina, the www.iaomt.org is a good place. It has a zip code engine on it, so you can plug in your zip code and find a holistic dentist in your area.
All right, we're there. Nice. Read it.
Mm-hmm.
Okay.
You want me to hold that?
You're not gonna put it in for me?
No. You want me to
Yeah,
hold
you
that?
can hold that.
Okay.
Cool. Rose, it's even got my name on it. I should say, how do I put it in?
Mm-hmm, you got it.
Just lay it in?
Yeah, let me get in here. This thing's not on with it.
Uh-huh.
Oh, really?
Uh-huh. Did I do it right?
Uh-huh, you did.
Okay.
Now, how does it feel sitting in there?
Oh,
Does it feel
there it's snapped in.
tight?
Yeah, it actually feels pretty good.
Okay, so when you go, does it feel like you're hitting anything except for your natural teeth?
I feel like I'm hitting that more than this side, but
Okay, you can tweak that.
maybe because it's new. I don't know.
All right.
Sure.
Now see if you can pop it out. In your mirror. Put one thing, there you go.
Wow.
All right, now put it back in again for me.
Okay.
All right, now this time you got that middle bar that goes around the front there, around those front teeth. See if you can kick it out with your tongue. Can you kick it out? No, that's good. That's what we
Okay,
want. We don't
that's
want
what
you
you
to be able
want.
to do
Okay.
that. Yeah, you took it out so easy. I was like, okay, I'll give you this side.
Okay, good, thanks.
Let you sit there with it in,
Mhm.
and I'll let them know it's a little bit high on that left side, okay?
All right.
But it may settle down the longer you have it in.
Good to see you.
Good, I'm excited. I got the
Thanks for
teeth in.
How they feel?
It's feeling pretty good, actually.
Good. Yeah, we want even pressure all the way across. That feels good. Now, again, this is the flange. There's a buccal flange and a lingual flange. One towards the cheek and one towards the tongue. Does it sit down in there pretty even?
Mm-hmm.
Good. This doesn't
thought
feel
it
too
did.
long anywhere?
No.
That's nice and stable. It's not going anywhere.
Ah, good job. Can't
Yeah.
wait to eat on my left side of my mouth now.
Go try it. Test drive it.
Okay.
Thank you, sir.
Yep. Call Hot Mama.
Calling Hot Mama.
It's like to hear Siri say that.
Hey.
Guess what? You can put steak back on the menu.
Oh.
I got my left grinders back.
Oh, good.
Okay. Feels good.
Good.
Hey Becky, look.
What?
Did you see it?
I did.
Where?
Papa's got teeth.
Oh, you got teeth put in.
Uh-huh. Hey, you see it?
Cool.
That's what Gideon said.
Well,
Kind of
you know,
little.
this is why you take care of your teeth, kids.
What? I like to think it was the Lyme disease, but maybe it was
the root canal.
neglect.
The root canal was neglect because we didn't have the money.
Okay, yeah.
And then when it was finally hurting so bad that you couldn't stand the pain, you had me make a dentist appointment, and by that time it was too late. If we would have taken care of it, the cavity before it got to a root canal point, maybe we could have avoided a lot of pain. But I'm not saying that Justin doesn't take care of his teeth, because he does, but if maybe we hadn't got the root canal, Lyme disease maybe not have happened. Like,
What would we have gotten instead of the root canals? Had it
well, he
filled?
would have just had it filled. He would have
Oh.
had it filled, a regular cavity.
Oh.
But it got so deep
Oh,
that it got
okay.
to the root and it destroyed the root.
All right.
So
Okay.